get a little break during the week to handle some personal issues, things like that, or at least to rest from all this hustle and bustle of, our daily living. Okay, so let's see who else has joined the class. Okay, we have Kiana, we have Tatiana, we have Danielle, we have Reese, and we have Xiomara, we have Jenny. Okay, good. Maybe a little bit later, somebody's gonna join the class, still early. Okay, so today's lesson, interpersonal skills. So very important. This has to do with communication. And remember, this is not just going to be applicable to your workplace, but to any interactions that you may have in every single things that you do in our life. So that's basically what it is. So interpersonal skills, very important, particularly in the workplace. Remember that we have to be very professional because the patients, they gonna make assumptions about you. They're gonna have a perception who they dealing with. And they're gonna generalize your perception, the perception that they have from you to the entire company, to the entire office, specialty. If you're not behaving nice according to me, I'm gonna assume that everybody else in that place is gonna be just like you. So I don't have a good impression. And that is very, very important for business. Create a good impression. So let's see how we are going to, what is it that we are going to be discussing during this class? So the importance of first impressions, I already mentioned it. I'm gonna talk about that in a little more detail. The difference between verbal and non-verbal communication is very important. And probably you're gonna be a little surprised how non-verbal communication is kind of tell more things than verbal communication, because we unconsciously are revealing things that we are not speaking, that we are not telling you. So we have to be very, very careful when we talk. And I'm talking about in any situation, whether in your workplace, whether with your friends, family member, whatever the case may be. Communication is very important, and we're going to see the types of communication and how they can affect positively or negatively the outcomes, whatever we're going to accomplish. Spatial separation. We're going to talk about these type of spaces that we have to keep depending on who are we talking to. Whether it is in the business matter, whether it's a social, whether it's in our relationships. So we have to keep certain space. Remember, we have to give space to people. You don't talk to people right on their faces. So we're gonna see how this spatial separation works. The value of touch while communicating. So see, people can perceive touch in different ways. Depends on how we are presenting ourselves, how we are communicating. There are different types of touch. And which one do we apply in the medical field? So that's basically what it is. Elements of the transactional communication model. What goes within the communication? What is needed? What elements are the participants of communication? Can we communicate to ourselves? I don't think so. Communication is always done between two or more people. We don't communicate with ourselves. We communicate with other people. We send a message. There are different ways of communication. We can do it by mail, by text message, by letters, over the phone. We can do it person to person. We can do it a video call, FaceTime, whatever you want to call. There are so many ways of communication. How do we know that this communication is being effective? Because we are going to have some barriers to effective communication. There's lots of barriers to communication. So I'm talking to you, somebody's making noise on the background, there is a train passing by, there is an ambulance. So noise, interference. In the workplace, we're going to have a lot of those, not just the noise. We're going to have people who don't speak our language. How are we going to communicate with them? How important it is to deliver an effective message so the patient can follow the instructions. Think about it. Just going to a place when you do not speak their language, it's going to be very difficult to communicate. And that's something that we have to take in consideration when we talk to our patients, not get desperately, not get stressed out. Oh, I don't understand this person. I don't know why they even come here. Why didn't you bring someone with you that speaks English? We get very aggravated, and that shouldn't be the way. Remember, we have to be empathetic. This is a country when we have tons of people from different countries, different languages. And as part of the medical providers, we have to have patience. We have to have empathy all the time. You have to be patient. Take a little time. We're going to have people who's not going to be able to see, to talk, not just because it has a barrier of language, no, or language barrier. It's because they have problems talking, communicating. They have mental conditions. They are elderly. They are uneducated. They didn't go to high school. They didn't have any of this education. Probably we are lucky to have. So we're going to talk about all these various communication. Culture. We will talk about that. We're going to talk about these defense mechanisms. You probably use it. I have used it. We have defense mechanisms. When we don't like something, when we don't understand something, when we have done something, we always blame someone else. We always make excuses. Those are defense mechanisms, but we have names for those. We gotta call them names. And the definition of each one of these defense mechanisms. So it's very important that we know. And we know when someone is using this type of defense mechanism to excuse themselves for neglecting, omitting, just not willing to do something, or have done something and they don't want to recognize accept that they have done something. And people use these mechanisms not just to defend themselves, but just because, there is no other way to answer something that they don't know or something that they don't want to tell you. So we need to be able to understand that and try to use the appropriate terms, particularly when we're going to get information from our patients. They might not be telling you directly what they need, but they use a defense mechanism. So we got to understand. If we understand the defense mechanism that they are using, now we can help them to get to the point that they want to reach, but they don't want to let you know what is it. Clearly, they are not communicating effectively with you. So that's basically what this lesson or chapter is all about. Talking about this way of communicating. There are certain questions that you have to ask yourself as a medical assistant. So first, how can the medical assistant treat patients as individuals during a busy workday? It's a lot of stuff. You're very busy. We're going to discuss that. And then this patient come over to ask you 10 times the same thing that you have already told them. How you handle that? How you handle an angry patient? How you handle a patient who doesn't speak your language and you don't have a translator there because you don't speak that language? How you going to answer that? How you going to answer a patient who's asking you, why is it taking too long for them being taken care of? They've been waiting too long. They were told that they will be seen in such a specific time. How to answer those questions? So, very important. Another thing that you have to take in consideration is that you are not exclusively dealing with the patients. You're dealing with family members, companions, someone who's taking care of this patient and they bring them to the workplace. How are you going to communicate with them when you have the patient and the family member next to them? Who are you talking to at that time? Regardless of who's translating or not, who are you focusing on at that particular time of the conversation? So that means professionalism. We're going to discuss that. So it's not just standing right in front of behind of the desk and asking, oh, hi, how can I help you today? And the patient is talking to you and you're not paying attention. You pretend to be listening, but you're not listening because you ask the patient to repeat again, even though if the patient clearly stated the purpose, the reason of their visit. So it's not just we talking to the patient and the patient should be listening. We should be listening too. So we're going to talk about these good listening skills, because that's going to take a toll on us if you are not practicing or learning these skills. So sometimes, remember, we talk about family members, friends, people who comes with the patient. Sometimes they can be a pain to us, but sometimes they can be of a great help to the patient and to us, not because they are probably being used as translators, but because they sometimes have more information about the patient than the patient itself. They can assist us with some procedures. The patient sometimes feel more at ease when, the family member is allowed to enter the exam room and assess that versus having someone else. So based on culture, people act that way. So probably you've been in that situation that you want a member of your family to be there when questions are going to be asked. Maybe you don't remember everything. Maybe the family member can, tell us a little more of what's really going on. Might be aware of the situation. The patients are very stressed out for whatever they're going through. So sometimes they don't recall much. They are too worried about what is it that the doctor is going to find. What diagnosis are they going to be receiving? So their minds are flying away from wherever they are at that moment. But the patient or the patient's family member or friends that accompany them, they might give us some of these answers that we need in order for us to complete some type of, history from the patient. So it's very important that we actually, take in consideration and appreciate our family members accompanying these patients, because we can get lots of information from them for any reason, whether the patient is too old to remember, whether the patient actually doesn't remember much because of the frustrations and, issues that goes through their mind at that particular moment. Somebody else's can help us out. But we need to know how to deal with these people and what information to release to them, because we're not releasing information, we're getting information. We're just telling these people that as much information as we collect, the better for the outcome of the patients, because we have more history collected. And less kind of, tests that we're gonna order. If someone already has been hospitalized, but the patient doesn't remember, a family member might know. Oh no, my family member got this surgical procedure like 10 years ago. So now we know something about the patient. Medications, sometimes the patient don't know medications. Well, usually 99% of patients, they do not know what they're taking. Oh, I'm taking this pill for sugar. That's what they said. I'm taking something for my stomach. And what I said, what do you mean for your stomach? I'm taking this for sugar. Well, we assume that is for diabetes, right? But do they know the name of the medication? Did they bring the medications with them? Do they have a list of the medications? Remember, that might be the first time that this patient is, being seen by these medical professionals. Because one of the things that I have heard every single time that I talk about this, they said, oh, but the doctor is supposed to have all the medications and names from the patient. Well, yes and no. I want to know whether you are taking those medications or not. This is like when you ask the patient's name instead of telling the patient name. Oh, are you Mr. Luis Rodriguez, right? The patient probably didn't even understand. Say, uh-huh. And then you're going to be dealing with the wrong patient. Instead of asking them, may I have your name, please? Last name. Your day of birth. It's totally different than me telling you, oh, is your name this? Is your name that? No, it doesn't work that way. Oh, you're taking this medication? And you don't even know what it is. No, I want to know from you which medication you're taking. Not something that it was prescribed, but you never took it. You're not going to be familiar with the medication if you're not taking it. So now I know why you're not getting better, not taking the medication. You're not supposed to know the name of the medication, but this is where communication comes to play. Before your patient comes to the office, you have to tell them. If you take Mr. or Mrs. Smith, if you're taking any medications, can you please bring a list of them? Or, just bring the bottles if you don't have the list of the medications. That's why when the patient registers for the first time, we give them a form, a registration form with a bunch of questions there, asking them family history, present history, their own history, social history. That's what is important, because we need to know a little bit about what's going on, not only with you, but with family. But if we don't ask, that is lack of effective communication. And then we start guessing. That doesn't work that way. So we're going to know as much as possible about our patients. And if the patient doesn't have the answers, maybe the family members have the answers. So we need to know almost everything that goes on with the patient, because the more information that we have, the better for us. I know exactly what to do because I have almost all the tools. You're giving me all the information that I need to run an appropriate diagnosis. What tests I'm going to order for my patient? And we have to be honest with our medical providers. We have to tell exactly how it is. If we don't tell, then you're going to omit certain information. Well, that's going to go against you, not against the doctor. If your family member has history of cancer or alcohol or drugs abuse and you don't want to tell because you feel uncomfortable, do you think that is too sensitive? You're not sure that all this information is going to be kept confidential, so you think that everybody's going to know what you're telling me? Well, lack of communication from the doctor side, because the doctor has to tell you, listen, all the information that you're going to tell me here is going to be kept confidential. No one is going to find out except the people that works in your care. So we have to be upfront. See, communication skills are a paramount to get things done correctly. Can you imagine you're moving from one borough to the next and you're asking someone for directions and they start saying, oh, just go to the left, you see to the right, then do. Well, that doesn't help me. Tell me a more specific data. I need more specific locations, because otherwise I'm gonna be I'm lost already. What do you mean that make to the right here, right there in the red house, you make a left and then keep on going for 3 blocks and then make another left and then you're gonna see this and then, well, I'm already lost. I need you to be more specific, meaning communicate with me more effectively. That's what I'm asking. So everything has to be clear. If I'm giving instructions to take medications to do this procedure, prepare for this procedure prior to doing the procedure, how am I expecting you to follow all the steps if I'm not communicating with you effectively? And that means giving you information verbally and written instructions. So if you forget about something that I told you, because I know you well, I'm going to give you written instructions. See, all the packages that you receive when you order something comes with instructions. Why? They don't, number one, you're not gonna be calling over the phone to ask how to do this, or how to take it, how to assemble, how to turn it on, turn it off. No, the instructions are there because it's hard for you to communicate with someone who you don't know where this shipment is coming from. And you know how the hassle of communicating with someone over the phone nowadays. Put you on hold for half an hour, and then it turns out that you wait all that time and you never got someone who answered your question. So you don't want a patient to be calling you over the phone 10 times to the office to ask you about what they're supposed to do, because that was lack of communication to begin with. So that's what I'm trying to tell you. Patients are going to receive some instructions and you're just going to tell them, okay, so you're going to go home and the day before you're going to go to the procedure, you're going to do this. You mentioned 3, 4, 5, 6, 10 things that they have to do prior. How am I going to remember that? If I have written instructions in the language that I speak, most definitely I'm going to go back to my instructions and trying to put together whatever information they gave me. Now I understand. That's what I'm trying to tell you. Communication. Because you're going to be very upset. I'm telling you that this patient is calling the office to ask the same questions. Oh, listen, I was there like a week ago. You guys gave me some instructions for a procedure. What was that all about? Can you tell me, please? Can you walk me through? And what is it that you're going to answer? Probably if you're in a good mood, you're going to tell it, oh, yeah, you have to do this and that. But if the patient called the second time, you're probably not even going to pick up the phone. And if you pick up the phone, you don't want to answer. You put somebody else. Oh, no, that's the same person calling. Well, you don't want that. You don't want this patient to come call 10 times into the office to ask for instructions about something that you gave them a week, couple of weeks ago, a month ago, because you're supposed to be giving all the information up front, including the written information. Because otherwise the patient is not going to follow the instructions. The test probably is not going to be done, not going to be done, or the procedure is going to be delayed. That's going to cause problems to the patient and to the office. Because we have to be there all the time for the patients. Remember, if something happens to the patient, we are responsible for it until proven otherwise. We will discuss that in law and ethics. We will talk about lawsuits, how lawsuits are. Well, we go back to the first thing that I mentioned today was the patient's perception. I talked about this yesterday. Remember, when the patient comes into the office, the patient started asking you something and you ignore them, or you just ask them to have a seat or to sign in the paper and to go have a seat in the waiting area, and you're minding your own business and you're not taking care of the patient. So all depends how you handle the situation. So immediately the patient is gonna assume that you don't Okay. You know what happened, right? So, oh my goodness, this is so ridiculous. Happen again. I try not to. Totally forgot to set up my alarm to tell me the time. Oh, this is not good. So that's what happened. My apology to you again. Even though if that does not work much. Okay, so can you guys hear me?
Yes.
Oh, okay.
Yes.
Once again, this is not news happening now. I hope that your perception of me is not that I'm just careless. No, I'm just forgetful. I don't know what's going on. I was aware when I turned my computer. I said, "Oh, still have good battery reserve." So I'm going to go. And then I start talking and I totally forget. I got too much caught up on what I'm doing. So, but anyways, we're back. So once again, the patient's perception about you, and it's not you only, it's the entire office. If I see that you're being rude, or that's how I see it, remember I mentioned that before. I'm just gonna assume that everybody in that office is gonna be the same. You already made my day. You just spoil it. That's basically what it is. Now I'm gonna get rude to you. Whatever thing you did, you tell me, I'm gonna raise my voice. So that's how things start. So not because the patient is right all the time. It's not because the patient's perceptions, impressions, assumptions are correct. Maybe not. Because remember, sometimes the patient just come, they are already upset about something. And they just go to the office and they blame everybody else for whatever problem. That is also correct. But remember, the patient is always right. And we're going to try to do our best. And what is our best? Not to show that we are upset. We are the one who needs to be calm down, not the patient. So that's basically what we need to do. We need to control ourselves. Yeah, the patient, as soon as turn into the waiting area, they are already upset. They are already making faces. They are already speaking loud to us. But we are not going to follow their path. We're going to be the opposite to that. We're going to show them professionalism. We're not going to be sarcastic. Remember, you're not going to tell them, oh, good morning to you, or thank you, when you know that they are screaming at you. So remember, patients are they get it immediately. The way that we act or react to whatever they say, they get it and they take it against us. So we're not gonna do that. We're not gonna follow their game, remember? Because that's what's gonna get us in trouble, not the patient. Remember, the patient generally do not get in trouble. 99% of the time, it's gonna be us. Why? Because we are the professionals. It's assumed so. Regardless of how the patient comes into our office. You know that dealing with angry patients is the most difficult thing to control. But if you don't control yourself, then things are going to be worse. They're going to get worse. So that's basically what it is. It's not that the patient is 100% right and that you're being rude. No, you're not being rude. They see you as you rude because you're not taking care of them immediately. If I'm busy, remember, I'm on the phone, I'm doing some other stuff, I have to acknowledge my patients. As soon as they step right there in front of you, you have to acknowledge them. If they don't, they just stand there. They don't say, oh, hi. Well, they do, but sometimes they don't say anything. They just look at you because they are angry. They think that you should run to them and offer your help. It's not that you're running, because if you're busy doing something else, you're distracted somehow. But as soon as you acknowledge their presence, you should immediately react to it. Oh, hi, how you doing? How can I assist you today? Simple. That's how we acknowledge people. Remember, when they are loud to you, when they are combative with you, if you use the same approach, you guys not going anywhere. So someone has to control themselves, and that's going to be us. We are the professionals, remember. So that's basically what the perception of the patient has. And this patient is going to spread the rumors that the people in that office, they are rude. They said in general, just for one person. Oh my goodness. And they're going to be trashing everyone who's working there. And they're going to be sitting in the waiting area and talking and looking at you and talking and looking at you and making you feel bad. So again, you try to do your best. That's the most important thing. Because then the patient is the one that is going to look bad, screaming at you, and you are being very nice, very polite, very respectful. Because remember, we're going to talk about body language as well. You can be saying some things, but then your face is showing something else. Your body language is showing something else. So everything that comes from your mouth means nothing, because the actions of your facial expressions and your body language mean something else. So that's basically what it is. First impression. Do you have to be shaking hands with everyone who enters? No, you don't have to be shaking hands. Culturally, there are some patients that they do not shake hands. So you don't have to do it. Do you have to be hugging people? Of course not. You're going to keep spatial space, distance. So you got to know how to do things and when to do it. Remember, if the patient comes sick and you get close to them, now you can catch whatever sickness they have, if this is a transmittable disease. You don't want that. So you're going to keep some space for respect to the other person and to prevent. So just telling them, acknowledging them and greeting them when they come in, that is it. You don't have to go beyond that. There is no need. Remember, these patients are not your friends, are not your family members. So you don't have to go all the way for them. Like, shaking hands and hugging and probably kissing on the cheek or anything like that. That doesn't work that way. So you have to keep it professional. The same way, remember, I cannot stress enough the way that you present yourself. You have to introduce yourself. You have to tell them who you are. What is your position? Don't let them call you different things, different professions. Because remember, that's illegal if you accept someone calling you something that you are not. So that's misrepresentation. of who you are in the medical field, that has consequences. So the first impressions, I already mentioned all of this, but it says right there, first impressions are not more than physical appearance or dress. Are more. Remember, it's just the way that you present yourself. Now, how clean you are, how nice dressed you are, how well groomed you are. It goes beyond that. So be careful with facial expressions and body language and your tone of voice. How high the pitch is, how fast you speak, how slow you speak. Whether you're looking at me when you're talking to me, or you just giving the back and it says, oh, I'll be right with you. Just because you heard somebody say, excuse me, I need some help. Or I'm here to see the doctor, and you are doing something else and you don't stop doing whatever you're doing. You just respond from wherever you are, the position that you have. Oh, yeah, I'll be right with you. No. When somebody calls your name or calls your attention in your workplace, you have to turn around, face them, greet them, offer your assistance, and ask your patient what help they need. And you have to be looking at them. You can't just talk when, you're giving them the back. That's very unprofessional, very disrespectful. Maybe you don't think that, that's important, but it is. Very, very important. So again, these first impressions are more important. So it says right here, first impressions includes attitude, compassion, smile, and we can see all that and more. Of course, you're not going to see all these in one shot. It is during the time that you are interacting with the patient. That's what it's called interpersonal skills. Inter means in between you and someone else. Remember, we don't speak to ourselves and then respond to ourselves. So we interact with other people. That's what is called interaction. Interpersonal. More than one person is involved. So if you don't practice this, you just have to put yourself in the patient's position and see what would you do if you are in front of the counter and the person that you're talking to, you feel that is ignoring you because that's the impression that you have. Because you're not looking at me when you're talking to me. That's very disrespectful. It is to me. So can you imagine I'm talking to you and then you doing something else and the first thing that I said, this person is not interested in what I'm saying. This person doesn't care about what I said or at all. Not interested in anything that I have to convey. So that's what's important. And this stays long. These bad impressions, remember, or first impression, but most of the time, if you impress me in a good way, in a positive way, I'm going to remember you. So that person was so nice. And anytime that I go to a place, I want to interact with that person. I want that person to take care of my business. But if it's not, and I have a negative impression about someone, that's not the person that I want to talk to again, because I already have an image. in my brain that I have a bad experience with this person during my interaction, whether it was the first time, the second time, but always we're going to have an impression that it wasn't pleasant talking to this person the first time that I did it. So from then on, it doesn't matter how nice you're going to be, the first impression, I'm not going to take it away. Because now you're trying to fix something that you did wrong. So that's basically what it is. You're not going to look at the person in the same way. Think about someone in your relationships. You have a friend that you thought was a friend. And then, he was talking in your back and you found out. Now you confront them. Are you going to trust this person the same way you used to be? Not at all. And this is someone who's being your friend. This is someone who you'll be sharing all your personal issues. This is someone that knows a lot about you. And you're not trusting this person anymore after you found out that they betrayed you. Now, what do you think about someone who's nothing to you? Well, it's even worse, because this person has nothing in common with you. So they're going to hate you. They're going to try to attack you every single time. So believe me, first impressions are very important. And in the workplace, and if you're the only one working there and you have to deal with these people every single time they come, because you already have confrontations with them. So it's not good for you. As soon as you see them coming into the offices, oh my gosh. Okay, my whole day is crumbled. Just because this person walked in and because you know that you have some differences. You don't feel comfortable talking to that person, but you have to do it because you're the only one working there. And for the patients, the same. So this relation is not going well. This person is going to talk to the doctor and he's going to say, the person that works in the front is very rude. Now the doctor knows that the person that's working in the front is rude, and not only this person, someone else came also and told me about this. So now I'm creating a negative image of you too, because I don't know how you're behaving in the front because I'm not there. I'm at the back in the exam room waiting for the patient, but I don't know what's going on. But the patient comes and tell you. I have patients coming and telling me, oh, the person that was there, I don't know if it is a nurse because they never know. Remember what I told you? Some of them, they don't even introduce themselves. They just start talking. Hi, how can I help you? Oh, please hold on. Oh, take a seat in the waiting area. I call you when ready. Oh, do you sign the paper right there? The signing sheet is right there. Put your name there. Have a seat, and I call you. Oh, seriously? That's being rude? Maybe you don't see it that way, but I do. And patients come over and tell me, oh, the person on the front desk, oh, the person was doing this, very rude, very disrespectful. I don't even know where you're working here. And this is not the first time. So then we're getting also an impression of who's working with us. So it's not just the patient. We will find out sooner or later. And these people that you think that are your friends in your workplace, your co-workers, they're going to turn you in when something goes wrong. I'm telling you. If they don't like you because you gave them the same attitude, because if you give attitude to the patient, you're going to be giving attitude to your co-workers as well. I'm telling you, this is about habit. You're not going to change. You try when something is convenient for you, but when something is not, So be careful with that. Having a job, being in charge, being in front of the desk doesn't give you the authority to mistreat your customers, your clients, your patients. At the contrary, you should serve as an example of what professionalism is. Remember, you're going to be the first person that the patient is going to be interacting with because you're in the front desk. Most of the medical assistants do works in clinics, doctors' offices. You do front and back. And these people is going to interact with you. Whether in the back, patient comes in with a requisition form, which is the order that the doctor gave you to draw blood or to collect these specimens, whether it's urine, blood, whatever the case may be. Said, oh, the doctor, oh, leave the paper right there, I call you. Have a seat outside. Wow. That's being very rude. Oh, let me see, please. Sure, what's your name? And compare the form that they give you. You know how many times the family member bring the paper because the patient cannot walk or the patient has a little issue and the patient stays in the waiting area, somebody else go, leave the paper there for them. You have to be nice, whether it's the patient, whether it's the family member, whether it's the companion, whether it's the home attendant, regardless of who they are. Have to be professional at all times. And make sure that you do it, that you're honestly doing it. Because if you are faking it, if you're acting, that act is going to fall apart. Whatever little issue triggers you immediately. Remember, just because we work here, just because we have a lot of work to do, oh, I'm so stressed out with all these things. I have to do 10 bloods right here and I have to go do this and that. That's too much. And this patient is taking my time out, asking me questions. No. I don't have time for that. Nada. That is unacceptable. So that's communication. Remember, that's attitude. That's the impression that I'm going to receive from you. And no matter how you nice are going to be next time or try to excuse yourself, I'm not going to accept that. I'm going to pretend that I do. But actually, inside of me, I'm being hurt already and I'm not taking it. And believe me, that's how we act. That's how we do it. So we got to make sure that that does not interfere with our job. Introduction. Mention this. Remember, most of these things are overlapping. And I just use this technique to tell you most of the things in every single chapter so you can remember these, because practice makes perfect, right? So every single time that I have the chance and I remember all those things that are important, not just for you to look professional, for the patients to accept you, but because these are questions for exams. They are, believe me. It sounds like, oh my God, that is so simple. How am I not going to know that I have to greet my patients? I have to introduce myself. Well, you have to know the steps. When you should introduce yourself, when you should ask the patients for name, last name, and day of birth. In which situations? You don't do that in every single field, in every single department. So we'll discuss that as we move along this. So that's basic pluralism. So when you said introduce yourself, said, hi, good morning, this is Alberto, I'm the medical assistant. How can I assist you? I already said who I am, so the patient know who are they talking to, who they are dealing with. Because when they said, oh, who took care of you? Ah, that person over there, that guy over there, that girl over there, that lady over there. Well, my name is not guy, my name is not lady, my name is not that person. We have names. When we collect specimens, you have to put your initials. When you enter information in the system about the patient, you have to put your initials there. So once again, you need to introduce yourself with the patients all the time. That's how we know who entered this information. The doctors sign these medical records because they are the one who collect the information from the patient. So we need to know who did it, who is responsible for that. And failure to do so is a violation to the policies of the company. If I have a question to ask, but I don't know who to ask because I don't know who entered this information. I don't know who completed, who did this procedure. And who's going to remember who procedure did to who? How you going to remember the patient that came for blood work and you did blood work like a month ago, a year ago, 10 years ago? Probably you're not even working there anymore. No, we need to identify ourselves. And with the patient is professionalism. It's the way to go. So I know who I'm dealing with. I know who answered my questions. I know who to call if I need something. Whether it was wrong or right, the way that you address the patient, well, they're going to tell this person did it. So that's important. So usually in your workplace, you have to wear a name tag or a name badge, which is an ID. It should. So people knows who you are and which is your position there. Remember, patients do not know the difference between a doctor, a medical assistant, and a nurse. Because all of you are wearing the same scrubs color, or maybe wearing scrubs. If you have noticed in the hospital, nurses wear one color of scrubs. Technicians, depends on what you do, whether you are the X-ray technician, the sonogram technician, the phlebotomy technician, the EKG technician, the medical assistant, they wear different colors of scrubs. Why? Because we are going to differentiate them from each profession. And people who shouldn't be in that particular department, well, we're going to recognize them by their uniforms that they're wearing. And they have a badge right there. So the name tag, you have to have it. And the patient has the right to see it, to read it, to see who they're dealing with. Remember, we have very difficult names in this country. So even though if I tell them my name, well, my name is easy, but for certain names that are difficult to be pronounced, so then they're going to be hesitant and say, you don't want to be repeating 10 times. Oh, no, listen, this is my last name. And you can pronounce it for them. There is no penalty because they pronounce the last name wrongly, but they know who you are. They see your picture right there in the ID. They said, oh, yeah, but they know more likely what's your profession. Remember, you cannot misrepresent yourself. Even though if they call you a doctor, a nurse, and you are not, you have to clarify this back to your patients. No, I'm not. I would love to be a doctor, but unfortunately, I'm not a doctor. I'm a medical assistant, okay, Mr. and Mrs. Smith? Here you. Doesn't make me feel any less. Because you got to be proud of who you are, what you have, where you are trying to misrepresent yourself for no reason. Smile. Now, remember that I told you that you smile depends on whose client you have in front of you. If someone comes screaming at you, how are you going to be a smile? This person is going to take it against you because they're going to think that you are making fun of them, that you're being sarcastic. I will be thinking the same. I'm telling you that I have this horrible headache or pain, and you tell me how you doing today. So just think about it. That's not effective communication with your patients. You're going to treat every single patient with respect, but you have to choose the words that you're going to use depending on who you have in front of you. This is not your friend. This is not outside that you see people say, hey, what's up? What's going on? How are you doing? Hey, I have heard that you were having a party last week. Well, this is not the people that you're talking to. This is a very professional, not informal. These are your friends, your family members. These are patients. They are not your friends. Remember, they are creating an impression of you and they can use it against you or to their advantage. I'm telling you, if you are too friendly, they take advantage of you. They start asking you favors. And how are you going to say no? And if you say no, now you are the enemy. Now you're not nice anymore. They were talking that you're very nice when they ask you for a favor. So don't. This is like when I was talking yesterday about receiving things that they bring you. They brought me food, fruits, they gave me gifts. No, don't. Don't take it. Believe me. This is gonna get you in trouble later on. Or at least with the patient. That's called bribery. They use it. Some people are nice because they want to be nice, believe me. But not everybody's the same. And now remember, this person is not coming to your home to give you the gift. They're giving in front of everybody who is in the waiting area. And these people, most of the time, they are our patients, so they are kind of regular. And anytime that you come in and you're gonna be willing that you're gonna pass them first. And if somebody sees that have seen them bringing you stuff, they're gonna call your attention. Oh, because I don't give you gifts, I have to wait, right? Because I don't bring you coffee, I have to wait, right? Wouldn't you the same? Wouldn't you do the same if somebody is going in front of the line and you've been waiting there for a long time, but this person just going from the line and nobody says anything? Because the person who's supposed to be speaking up just allow you to pass? Not good. Remember, patience, seeing everything what you're doing. That's why you greet these people in a professional manner. Think about it. No hugging, no extra words right there. No, everybody, hi, how you doing? Or depends on how it is. How can I help you today? How can I assist you today? So if you kind of using same language for everybody, people is gonna say, oh, they greet me the same way. Oh no, but you hugging me, you calling me honey, you calling me sugar, you calling me papi, you calling me mommy. And when I come here, I said, oh, what do you want? So we see all that. We see it. And we know that as soon as someone comes in and being very friendly to you, we know that this person is gonna pass first. We know. And we are already upset because we've been waiting right here in the waiting area. That's what's not good, to bring family members, to bring patients of family members or friends to see the doctors that you are taking and that you are assisting, because you're going to have rough time with other patients, seeing your family member passing first, or your friends, or having just, privileges, if you will. Not good. I'm been in offices, public buildings, doing some paperwork for something. And I see things happening, so I'm not happy about it. Of course, I'm not going to speak up because, that's going to go against you. But that's not what something that you should be doing. That's unprofessional. If the patients are new or the patients are asking for the restroom, or where is the doctor's exam room at, give them directions. Walk them through. Depends on the person. If it's an older person, I will go there and I walk them through. Oh, Mr. and Mrs. Rodriguez, go to exam room 1. And we have a bunch of rooms, and it's all the way in the back. The patient is going around. Well, if you have the time, just walk in. Walk them around, show them what the laboratory is. Because when they finish talking to the doctor, usually the doctor orders blood, urine, something else. That's being a good professional. Most of the people who goes to the medical doctor, they want to use the restroom. So make sure that they know that you have a sign on the door indicating whether this restroom can be used for everybody or it is only for males or females. It has to be identified. So again, sometimes you have to introduce other stuff. This is like when you get a job. Can you imagine somebody says, okay, this is my first day to work, and you come over there and says, oh, hi, my name is Alberto Hoyer, and I start today working here as a medical assistant. And you just talk to one person and says, sure, just stand over there, follow the person over there. Oh, seriously? No, I'm going to walk you through. That's called orientation. Put me at ease with the facility, with the people that's working there. I'm not familiar with this area. So somebody's putting me at ease, just helping me out with that. Oh, this is Mr. Brown. He's the office manager. She's the nurse. Her name is whatever. And this is the doctor's office. We have 3, 4, 5 exam room. We have 1 exam room. This is the lab. Here's when you're going to be drawing blood. Well, the same we go with the patients. So we don't do that. We don't do that, unfortunately. Patient comes in and we barely tell them what's just because it's there. Have a seat right there in the waiting area. When the doctor's ready to see you, they're going to call you. And we don't say that. We don't say when the doctor is ready to see you, they will call you. No, it says, oh, take a seat. The doctor is going to call you in a few. The doctor is going to call you soon, which is wrong. Because it's not like that. Because if I have 10, 20 patients over there and I just arrived, what makes you think that they're going to be seeing me soon? What is soon? 3 hours later? That doesn't work that way. So be careful how you express yourself, because the patient takes every word exactly how they interpret it, because it's not effective. So what is soon for you? And I believe that if I hear the word soon means right away. That's what it means. So if you tell me that the patient is going to be seeing me soon, I'm expecting that seriously. When I see another patient coming out from the room and they calling another patient, I'm going to be stepping right there and calling your name. Hi, excuse me, miss or mister. You told me that the doctor was going to see me soon, but I'm seeing a couple of patients already leaving and he's calling someone else. What is soon? Now you have a confrontation for that. So if you're not sure about things, don't promise things. Remember, it's what we said and how we said. That's the problem. False expectations is called. So you're not putting the patient at ease at all. Little things. You might think that this is not important, but oh, it has consequences. So it is important. And I'm seeing altercations with patients for this reason. And for that reason, I'm bringing it up with you and with all my classes. Don't compromise yourself. Don't reassure someone of something that you're not sure and you know it's not going to happen that way. We will talk about that also when we go over, patient scheduling, when they make an appointment, whether they make an appointment or they just walk into the office. How do we go about that? But again, when the patient is there, we have to be very careful how we communicate. Remember, some of them, they're not inside our brains to understand what exactly we imply when we say something. And the way that you say it in a very general terms that I'm taking the option that I want the most. If you say soon, it's not, no. Soon as they finish with all these people. No, that's not what they say. It's not as soon as when they finish with everyone who's in the waiting area. No, I said soon as they release the patient that they're seeing right now, I'm going to be next. So don't tell them anything that you're not sure about it. Be specific. So the correct words to say is, Mr. Mrs. Smith, please have a seat. The doctor is going to call you when your turn comes. Oh, how long is going to be that? I don't know, man. I don't know, sir. Not for sure, because see, you have several patients in front of you. You have to be realistic. That's the reality. Otherwise, I'm going to think that, yeah, all these people that is here, they're not going to be passing me first. So I'm going to go before them. I'm going to be in front of them. So verbal communication. So let's now move to whatever we're doing today and every day is communicating using verbal communication. So when we use verbal communication, we speak clearly and enunciate properly. Remember, if I don't speak clearly, whether it's the language that you speak, because for you, it doesn't matter how clearly I am, but if it's something that you don't understand, it doesn't matter. But if you understand the language, you have to speak clearly. So enunciate that you are pronouncing the words the correct way so they can understand you. There are some words that are very similar. They almost written the same way, but they are pronounced a little bit different. And if we don't pronounce them correctly, well, it's going to create a little confusion. So we're not going to speak too fast. Your pitch of voice needs to be, it has to change. Depends on what you're saying. You can't be flat like a robot. Talking like, oh, okay, today we are doing this. Oh, excuse me, mister. Doesn't sound kind of good, right? There are some words that we have to make an accent right there at the beginning, at the end, in the middle, whatever the case may be. If it is kind of more important, you make a little more emphasis on those words. Otherwise, it's going to become monotonous, boring. And always, always, always speak with some pauses in between. Because other than that, you're not going to be able to pass this message, transmit this message. Remember, we're going to have a bunch of patients that are going to have problems with hearing, talking. So speaking, they're going to have problems there. And then you don't expect them to hear you in the same way that a normal person would. So you use an appropriate volume of voice. You're not screaming, but you're not whispering either. But you also have to take in consideration that if it is something very sensitive that the patient wants to tell you, and they start kind of speaking in a low tone of voice, very low tone of voice, you got to be careful asking the patient to speak up and loud, because they're not going to do it. You're going to get upset because you're not following anything about how to communicate with your patients. So that's the importance about these classes. It's not, well, you know how to communicate. Yeah, I said, oh, big deal, right? I know how to talk. I talk better than you. That's not the point. The point is to deliver this message to the other person, meaning that the other person actually understands what you're saying. That is the key. And you should be also listening. Remember, this isn't our part. We are the professionals. We are not expecting the patients to do the same. Excuse me, can you speak like slowly, enunciate better because I don't understand what you're saying? That is very rude. We don't say that. We don't tell that to our patients. When you notice that the patient is having difficulty speaking or something like, look for another way of communication or take the patient to a private area and talk to them because you are embarrassing them. And you think that you're not even thinking about it. That's what you're doing. You're embarrassing them in front of the people that are there in the waiting area, or the people that are next to the patient, also waiting to be taken care of. That's having patience. We need to do that every single time. Once again, we need to make eye contact. These are questions for exams. You have to speak clearly with your patients. You have to be a little slow. The pitch has to be in a normal pitch, not screaming to the patient, because you don't know what are the conditions that the patient has. We don't talk to everybody the same way that we don't greet every single patient in the same way. We're not going to be talking to them in the same way. I'm raising my voice because this person is asking me, oh, excuse me, can you repeat that? Now I get offended. I get already, pissed off. And now I'm going to scream. Oh, what I said is this. Remember that your tone of voice immediately tells me whether you have an attitude or not, whether you actually like me being asking questions, or you just get offended and you don't want to respond, or you just want to repeat it. That's how I see it. Remember, the perception is continuous. It's not like, that's it. I treat you bad today and good tomorrow, and then I treat you. No. We're going to see all that. This is like with friends. Today they saying hello, how you doing? And they call me, then they don't call me for 2 weeks. And then when they need something, they call me. We know all that. And we already thinking, oh, well, they're just calling me because they need something. And when they need something, they're very nice. They greet me, they ask me how am I doing, how's everything going. Other than that, they don't even pick up the phone when I leave a message. So again, they don't return my calls. So eye contact. Remember, I was talking before, I'm doing something, I'm busy. Don't talk to people like that. Keep on doing your things. You stop and you face your patients. Hi, good morning, good afternoon, good evening. How can I help you today? And believe me, most of them are going to be very nice. If I was a little upset, as soon as I see that you're being very nice, I'm not saying everybody's going to act the same, because if you already have a problem, you're already stressed out, well, it doesn't matter how nice I am, they're still going to be rude to me. But remember, I'm the professional, so I have to show professionalism at all the times, at all times. So I'm talking to you, I'm listening to you. Now, be careful, because there are certain cultures, like particularly some of the Asian populations, that when you're talking to them, they don't look at you. They lean forward the head, like they bend a little bit the head, and they're not looking at you. So be careful telling them, hey, look at me when I'm talking to you. Or you're not interested, right, in what I have to say. Remember, these are not our kids. These are older people. These are patients. We are not related to them in any aspect of our social life. This is a work-related relation. So it has to be professional. That's what's important. There are some patients that do not shake hands. That's another thing. That's why we don't shake hands with everybody. That's why we don't hug. That's why we don't kiss people on the cheek. That's too much. Not to mention, to prevent these transmittable, infectious diseases for getting too close to someone. But that's the way it goes. It has to be in a professional manner. So eye contact, taking in consideration some of the Asian population, because you can just point out, says, oh, this one. Most of the time, the Chinese, they showing you respect when they don't look at you, particularly when you are a superior, whether you have a title or whether just talking to you, they don't look at you, they just kind of lean the head forward, but they are in front of you listening. They are listening. That's a way of giving you respect. So in this case, it's the only time there is an exception to the rule. But we are not talking about the patient. We're talking about ourselves. We have to be looking at the patient. If the patient is not paying attention, we're not going to call their attention. Excuse me, I'm talking to you. What's wrong with you? Are you really interested in what I have to say or not? But yet, when you are talking to them and you're turning their back on them because you're busy doing something, how you feel, how you think we feel. But this is the same way. So if you want to be listened, someone has to be paying attention to you. Well, you should be doing the same, particularly because you're the professional. And all this applies to us. It's not to the patient. So we are the one who has to have eye contact. We are the one who has to speak in this way, using these technical skills, not the patient. So think about that. Because that's the problem, that we act the way that the patients act. If they treat us bad, if they insult us, if they speak loud, then we speak louder. Because we have more power, right? Very wrong. Doesn't work that way. Doesn't. Show concern. We know that we speak on an animated fashion, meaning, remember, don't be a robot. Don't just go plain, because you're going to be very bored. This is like, when you have to enunciate something, you go your pitch up and down. That's how it has to be. So now I understand whether you're asking me a question or you're telling me something. So if you are ignoring me and right there at the moment that I step in front of the counter and I'm just saying, hello, can somebody help me? And people just walking around and ignoring me. Oh, I'll be right with you. Not good. Supposed to greet them, being polite, respectful, professional. And if you're doing something that really can wait, then you do it. So like you are on the phone with another customer, another client, another patient, or you're talking to your friends, it doesn't matter. And the patient arrives to the office and asks for assistance. You should stop whatever you're doing. Always stop whatever you're doing. Excuse yourself with the person that you have on the phone. The person that you're talking next to you, that is your buddy, your coworker. This is business. You're gonna excuse. Hi, I'm sorry. I'm gonna put you on hold for a sec, okay? I have another customer right here on the line, or I have a customer in front of me. You put them on hold. Hi, good afternoon, good evening, good morning, whatever the time it is. My name is Alberto. I'm a medical assistant. How can I help you? Oh, I have this. That. Okay. I'm on the line. As soon as I get off the line, I will be with you, okay? But I already acknowledged you. You know that I'm busy. You know that I'm doing something, but I already spoke to you. That's it. Very simple. And you continue doing whatever you're doing, and you are brief as possible with the other person, and then you take care of the person that is there. That's showing concern. You care about my business. I see how you behave towards me. That's basically what we need to do. Do not interrupt a person who is talking or speaking to you. Do not get involved. Let him finish. Yeah, you're in a hurry. Still think that the patient is talking too much. There is ways to kind of cut the conversation without being rude. So the patient is trying to explain you something. Yeah, I know. Can you kind of hurry up because I have too many patients to take care of, or I have other things to do. It's like, hey, you're wasting my time. That's what you're telling them. You don't do that. That's why you ask the questions. You ask the questions. May I ask you, what's the reason for you today here in the visit? What is the reason you want to see the doctor today? Sure. Oh, listen, I have this, but by the way, no problem. We are going to, you're gonna sign right here, and the doctor is gonna see you. All of the questions that you have, write it down, keep it in the back of your head, and when you see the doctor, you're gonna ask all those questions, okay? Don't forget about that. There is anything else I can help you with? No, that's fine. So you don't have to entertain everything the patient is saying, talking about one thing and then jump into another one, talking about family, work. No. You don't get engaged with people. Not like that. You just ask the pertaining questions and you ask the questions. Oh, I've been having this, blah, 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 blah. Start talking. Then you said, oh, excuse me, Mr. and Mrs. Smith. Besides what you told me that you have this pain in your stomach, do you have nausea? Do you have vomiting? Oh, no. Okay. So, not a problem. Please have a seat. Please sign right here. Do the next step. See, you intervene for them. Oh, I understand that you're having all these issues. Have you had this? Do you have this? In a very professional way. All this is practice, but choosing the correct words and how you're going to intervene without actually disrupting their conversation. And if they are talking about something very important, let them finish. Don't assume that, they told you the whole story. Once again, it's not that you're going to stay there the whole day listening to their rant. You are just going to be asking questions. So that's the best thing. Any questions about this part of verbal communication? Well, you know that most of the things you're familiar with. Now, what we're going to do is we're going to put that in practice. We're going to put it to work. And remember, patients are having a perception of who we are, and that's the way they think. Remember, it's like when we encounter someone, let's say we have a family friends reunion, and they introduce us with somebody else new. As soon as the person introduces themselves, we make lots of assumptions about the person, don't we? So what makes you think that the patient is different? And this person is not coming here for help. This is one of the person that they introducing you as a potential acquaintances, maybe a friend. But sometimes we don't like the person. They start talking and it sounds like very tacky, cocky, arrogant, and we already make an assumption this person is this. Well, your patients are going to be acting exactly the same way towards you. That's how it works. That's how it works. The same way that we interact to other people in different settings is how we see people, is that how they see us. And sometimes you don't have to be nice enough. Oh, it doesn't matter how nice you are. People are not going to like you. When they're not going to like you, they don't like you, period. They don't like you because they see that they are different from you. They said, oh, this is too good to be true. So they're gonna like this person more than me. So I'm gonna trash them. I'm gonna say that I didn't like it, I didn't sympathize. I'm gonna look for all of the issues that I think because I have in my mind already. So that's exactly what your patients are thinking about you, the same way that we think about other people. When we see them, we start judging them immediately. They have not even crossed a word with us, and we are already trashing them. Is this someone walking on the street? Oh, look at that clothes. Oh, how horrible it looks like that. Look at that hair. Look at that nose, those ears. Look at the body. Start criticizing people because we like to judge people. And that's how impressions are all about. So once again, it doesn't matter how nice you are. People are going to make their own assumptions about who you are, but you be yourself, be real, be professional, and that is all it matters. Me personally, I don't care about people think about me. Remember, I mentioned this before. Don't take it personal. You are not paying my bills. You are not doing this. You are not doing that. Well, then why should I be worried about what they think about me? I do my job. I do the best on my job. Well, if my boss keeps me there, patients are, well, most of the patients say good things about me. Well, there's always someone who's not going to say something good about you, not because you're not good. It's because they just feel that they don't like you. For some reason, whether because you're too good or because you're bad, it doesn't matter. Think about these people out there in the media. Oh, I like the singer. I don't like the singer. Oh, but this is the same thing. So we don't have to be liked by everyone. So that's how it works. So don't take it personal. If you don't take personal things, you don't take it to your heart, believe me, you're going to survive in any single environment. You're going to survive. I have. I see many people just arguing for simple things. I don't have to go through that. I don't waste my time. My time is really important. Do you think that I'm going to have a headache just because someone is saying something about me? Not at all. Not worry at all. Remember, I work, I buy my own things, I have my family, I care about them. And if they don't care about me, so be it. I don't care about them either. If you're good to me, I'm good to you. If you're not good to me, I'm not going to be bad to you. No, I don't pay that way. I just ignore you. I just, you don't exist. That's it, period. Because I don't take anything personal at all. Believe me. Much less I'm going to be worried about patients. Seriously, what they think about me. No, I'm just going to be professional. I'm going to do my best because this is a workplace. That's it. You don't have to be like. If that's what you're looking for, then that's not going to happen. That's not going to happen. Tone of voice is very important in communication. Well, we mentioned this already. Never be sarcastic. Anything that you said, just like in the court of law, it will be used against you. So don't try to be too nice, be normal. You don't have to go the extra mile. Because sometimes that, can bite you back. So that backfires sometimes. So don't be too nice, but don't try to be rude. Just balance yourself. This is homeostasis, remember. Sarcasms are very common. People say things that they don't mean it, but they say it with certain tone, then it is a sarcasm, not a compliment, if you will. Never be rude. Well, talking about rudeness. So that's basically what we have to be, particularly in our workplace. I mean, you shouldn't be rude to anyone in any setting with anyone. But you know what? Someone who my job do not depend on it. Somebody's rude to me on the streets or something like that. Well, I'm gonna speak up because I'm not stupid. It's not that you can roll over me. And I'm just gonna say, hey, oh, you hit my right cheek. No, take the left. Oh, no, don't go that far. But I'm gonna stop wasting my time? No. Most of the time, as long as physically we don't get involved, you don't touch me, you don't push me, all the words that you said, I don't care about. So that's what you have to think, because that's not taking things personal. Never make an inappropriate remark and follow it by saying, oh, I was just kidding. See, in the workplace, this is something that happens with your friends. I do this with my friends. I mentioned something and said, no, we're just kidding. I was playing. But this is your friends. The patient's not your friends. And they're going to take it differently. They're going to take it as if you are making fun of them, or as you being sarcastic or rude to them. That has consequences. So basically, that's what it is. Remember, whatever you're saying, you might be hurting somebody else's feelings. So choose the words that you're going to use. Trying to be funny with patients do not work. I tried to be funny once, and I learned my lesson. Because I always come out with this silly, not going to say the word, but those kind of jokes, and the person didn't take it the way that I was intended to say. Actually, it kind of, get me in a little uncomfortable discussion, because I was trying to explain, but then, explanations after the damage is done, it was not personal, but it was something related to be personal. Because I never attack someone with personal issues. I don't. I was referring something in general. I was being kind of biased, if you will. That backfired. So I was like, oh, wait a minute. This is not going to happen again. And I learned my lesson, because we made mistakes, but if we learn from those mistakes, and we don't do, because we are humans. We are not perfect. But learning all these guidelines of how to communicate, how to deal with your patients, how to address certain situations, well, it's like we know it. And falling into this trap of doing it, it's not going to help you, because it's going to cost you more time for you to fix it, that to prevent them to happen in the first place. This is like any disease that can be controllable. Shouldn't be drinking. I shouldn't be drinking a lot. That's going to destroy my organs, my system. I'm going to get sick, but still I do it. I didn't learn anything. I don't have to, get sick to learn. No, I see other people that got sick for doing it, so I don't do it. Oh, no. If I don't try it and it doesn't happen to me, then it doesn't happen. No, that's totally wrong misconception. So just because some patients, you say something and they laugh about it and they cool with that, don't think that everyone is going to be taking it the same way. Remember, we have different times, different moods. We have a good mood, might laugh at something. It's not even funny. But sometimes we are so sensitive that someone said something, even though if it is good, we're gonna take it as take it as a sarcasm. So once again, don't hurt somebody else's feeling by saying something inappropriate. So don't say at all. I'm telling you. Some people might not say it to you, but might make the comments to other people, which is worse. Because if they tell you that they didn't appreciate what you told them, or what you say about them, I might be able to correct it because this is, the two people that are involved with the situation. But when these comments spreads around, now we have a gossip. Now we have a rumor. That's what we're gonna get. Verbal communication depends on words and sounds. So you will have questions for your national exam about communication. Verbal communication, non-verbal communication. So we will be discussing a lot of stuff about verbal communication. Then we'll talk about non-verbal communication. Patients need tender care. Now, think about this. What is it that the patients are coming to your office for? They're not coming to say hello. They are not coming to bring you something. And personally, I just stopped by to say hello. I just stopped by to bring you coffee or to bring you this little present. No, they come with all these issues and they want these issues to be taken care of, to be fixed, if you will. That's what they want. Who wants to go to the medical office just to chill? Seriously? That's not happening. They are there because they are concerned about issues that's going on with their health. Remember, when we talk about health, we're not talking about something physical. My leg hurts. I broke my arm. I have this. No, we're talking about mental, psychological, emotional, social. Patient can come over to my office because I have a headache. This is a bad headache. I'm very stressed out. So then, do you hit your head with something? Do you have any problems with your head? Have you been diagnosed with something? No, nothing. Oh, so you don't have anything, so just go home. No, that's not how it works. I have to do a little more investigation. This person was already fired from work. Now doesn't know how to pay the bills. So I have a big headache right now. So this is social. Now it's getting emotional. They have a family member that they lost. It's not that you're sick physically. You have issues, external issues that are causing you to be like that. So that's basically what we need to understand. Just because you look good, you came dressing very nicely, does not imply that this person is coming to waste my time. They should be really nice. They should be pleasant to me. Wrong misconception about how patients should be acting according to you. So they are always concerned about something, apprehensive about something, scared or fearful about something. They have a bad diagnosis, or they feeling really bad about something within their body that is not working, and they are afraid to receive bad news. Think about this patient that a tumor was discovered, and a biopsy was ordered. Now they are here today because they're going to get the results from the biopsy. And the first thing that you think is you're going to get bad news, because when we hear about tumors, the first thing that we think is about cancer. They're not just going to be concerned, apprehensive, they're going to be very scared about receiving bad news. Who wants to receive bad news? Nobody. So they feel like they need help. We need to help them. But the first thing that we do when they show up, we ignore them. We are rude to them. We don't care about the people to visit our office. We only care about ourselves. Not good. Not good at all. You can change the whole picture presentation by just being nice, by just being professional. Believe me, I'm being in very, very bad situations with not myself. Thank God I haven't been in a situation that I have a condition. Thank God I don't have medical conditions. But I've been working in the medical and I have patients that have terminal illness. Have patients that, the life expectancy after they've been diagnosed is weeks, probably months. That's horrible news. So the first thing that you do is, you have to have compassion for these people. Immediately I see this person if it was a member of my family or if it was me. I reflect everything that goes to other people. What if that will be happening to me? And that made me more concerned, more careful about the words that I use, the approach that I use when I deal with people in general. I'm not perfect, not even close, but I'm very concerned about things that goes along the people that I interact with, particularly in my workplace. I don't let those things to hit me like, well, I give a bad news to someone that, you have few months to live. It's very sad for me to give that news, but I don't let that news from this patient to affect me emotionally. Try not to get involved because then I'm not going to be able to function. So you should not get caught up in these type of situations. Yes, you're going to feel very, sympathetic, empathetic with someone. But at the same token, not take it to the heart because that's going to affect you. The way that you behave, way that you conduct yourself, the way that you do your job. Because working in the medical is tough, particularly when you are involved in situations when your patient dies on you, when your patient looks a member, not member of the family, a extremity, we have to amputate this arm, this leg, you lost the eye, you lost something. You have to have compassion. So being concerned, that's basically what it is. You have to be concerned all the time with your patients. Not because they come to your office and you see them complete and, oh no, you're not missing anything. Well, you don't know what is inside. You don't know what is going on with their lives, with your social, family, your financials, nothing. We don't know anything about them. So something that's going on in their personal lives, whether it's physical or emotional or else, is affecting them and they come to our office because they need help. So we have to be there for them. Not that we're not solve the problems, but we're not gonna make it worse by being rude to them, by not listening to the problems, but taking things lightly with them. It's not gonna sit and cry with them. No, that's not how it works. But at least paying attention, being respectful, having compassion, empathy, 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 empathy. Here we go again. Listen to the patients. See, sometimes we are busy. We don't have much time to sit and listen to the patient's complaints and, issues. But then what is it that we're there for? Remember, we allow the patients to do most of the talking. Who is bringing the problems? Who needs the problems to be fixed? Well, you have to tell me what is it that is going on with you. So we have to listen and we have to ask the appropriate questions. That's another thing. That's when we intervene. The patient is talking and talking and talking non-stop. Well, let them finish some little part and then you intervene. Then you jump in and I ask a question. So you interrupt this chain of issues that they are telling you. Because we are not going to solve the problem right there. This person needs to go through the doctor. Now the patient needs it. So that's the time that we tell them, I do understand all the things that you want to tell me, but you know what? You're going to tell them to the doctor, okay? Write it down. Just keep it in mind. Every single thing that you're telling me, you're going to tell the doctor when you see them. That's how you do it in a nice way without saying, oh, listen, I do understand you have a lot of stuff right there. You don't have to tell me that stuff. Just talk to the doctor, okay? For now, just have a seat. Oh, seriously? You're dismissing me. You're not concerned. You're not caring about me at all. Did I sit and cry with you? No, you don't have to go the other way either. Remember, you have to be balanced. Showing your concerns does not imply crying with them or screaming at them because they are screaming at you. That's not how it works. Do not offer personal information about your own life and problems. So this is the thing. When you're talking to the patients and you have something that you kind of relate to the patient, oh yeah, you know what? That happens to me to happen to a family member, and you start getting involved and telling the story of your family, of you, to a patient. That is inappropriate. That is a no-no. You don't get involved. Who is this person? You're already telling them. That's not gonna make the patient feel better. That is not. Remember, we are medical providers there. We try to kind of, manage our time because we have lots of patients there to be taken care of, because we have all these administrative things, these clinical things that we have to finish with all these patients. So we don't have too much time to be talking. Allow the patients to do most of the talking. Does not imply allow them to talk and, well, to give a class. No, that is not what we need. But we need to know when to interrupt them and how we're going to interrupt them by asking another question. Letting them finish one part. Oh, listen, I'm here because I have this pain. Okay, and for how long it's been going on? Oh, it started like yesterday. But you know what that says? Do you have any fever? Do you have diarrhea? Do you have nausea? Depends on what you're talking. You kind of, as soon as they said a little bit, you interfere because you want to make sure that you have all the information. Or if you don't have any other questions, you tell the patient, well, I have enough information. When you go to the doctor is going to ask you more questions. So make sure that if you have any other questions, you ask the doctor, okay? Without being rude. You see, if I tell you that, you're not going to get upset at me. You're not putting yourself down either. Oh, I'm a good listener, so I'm going to stay there. No, at the workplace, we're not good listeners for a long time. We just want to listen what is the most important thing, what we can do there, because there are a lot of things to do. Share only positive experiences and then only briefly. Now, I understand what you're talking about. I'm being through that. I'm a female, so I'm going through those things. That's it, simple. You're not revealing anything. You're not revealing what exactly you have, but you kind of, putting yourself in the same situation as the patient. Or I know how you're feeling. I have a family member that is going through the things that you're going. I know how you're feeling. So that's it. No, that's how you can participate, because that's showing the patient also that you're concerned. And not only that, you're telling the patient, hey, you're not the only one. There are other people that are going through this. So that's going to kind of relieve a little bit the pressure, the stress that you have. Oh, wait a minute. So I'm not the only one. So I'm kind of overreacting about this. They put a lot of things in their minds. Think about that. Everything is, how you kind of add little things to make things better. So it has to be positive. You not add negative things. Oh, that is too bad. Seriously? And anyone in your family also have that? Oh, probably that's hereditary. Oh, you guys screw. Seriously? We don't say things that we are thinking probably. Remember, we're trying to fix, not to make things worse. And watch the language that you use, because that can be not only offensive, but belittling as well. So again, if we're not going to say something positive, it's better not to say it. Don't try to be impassive with someone bringing up something that is going to make things worse. See? Do not burden the patient with your problems at any time. Don't do it. Don't tell your stories. This is not about you. Even though if the patient has something similar that you have gone through it, remember, the only thing that you can say just to make the patient feel a little bit at ease, to let the patient understand that it's not her or him, the one that's going through this, that you understand because you have gone through that. You have faced that, or a family member has had, or going through the same, living it right there. So that's how we are going to address these issues. Okay, so I think that it's time for break. I mean, if you guys want it, because if you don't guys don't want no break, because I see that you sometimes don't like my breaks. So if you don't want to break, that's fine. We just can continue. So I'm all ears. Oh, you don't want to break? See, someone says don't want to break.
I said I do.
Oh no, you see, I wasn't listening actively. See how it goes? I understood what is convenient for me. Okay, Mercedes, but you're the only one. What about the rest?
I'll take a break too.
Oh, now Danielle wants a break. Anybody else
I'll
wants a
take a
break?
break. I'll
Of
take a break.
course,
I'm trying
Xiomara
not to
wants a
dominate the
break.
voice. I
Jenny
take a
wants a
break.
break. Yeah, now everybody wants a. Tatiana wants a break. Yeah.
You get a break. You get a break.
Yeah,
Everybody get a
right.
break.
We're gonna fight for that break. Okay, guys. So see you then at 7:36. You know what? 7:40. Okay? Enjoy it.
Gotcha.
Take care. Uh-huh. Okay. So we are back. We're gonna continue this interpersonal skills. Any questions?
None.
Okay, so let's move on. We talk about verbal communication, remember? Just every word that comes from our mouth, the tone, enunciation, that's called verbal communication. Now we're gonna have non-verbal communication. If you see here, 70% of the words or the actions that we do are non-verbal. So how much is it that is verbal communication? Well, verbal communication is a very small portion of the communication. So keep it in mind when you see questions about verbal and non-verbal communications. So then you need to think about that non-verbal communication is larger, is most generally used than verbal communication. So that is what we need to understand. So the tone of your voice, remember you are speaking some words, but your tone of your voice tells me whether you are upset, whether you are happy, whether you are spoiling me, or whether you are upset. So it's very important to pay attention to every single thing that we do. See, spoken communication, 7%. Can you imagine? Versus 70% of nonverbal communication. That is a lot. So nonverbal communication is more common than verbal communication. And you see how we communicate, right? But when we communicate at the same time, we are using facial expressions, body language. They might not convey whatever words we are allowing to come out from your mouth. Remember, one thing is what you're saying, another thing is what actually your body is showing. That's why nonverbal communication is more. You don't have to say anything. See, you are dealing with the patient. He says, oh, Mr. and Mrs. Smith, we're going to draw blood. They don't do anything, just nod, saying yes. Or they just pull up the arm. They raise their arm. Or they just take a seat on the chair that they're supposed to be sitting to get their blood drawn. You're not saying anything. So most of the communication is nonverbal communication. So remember that. So what entails nonverbal communication? Well, through all these lessons, I've been talking about that. I just mentioned body language, gestures, mannerisms, eye movement, everything that you do. You're not talking. See, let's give an example. A patient comes into the office. As soon as they come towards you towards the front desk, you start rolling your eyes. You're turning around. Uh-oh. No, this is the one. Oh, that's the one that gave me trouble last time. Oh, that's the one that's telling me this. Oh, that's the one that came with this problem. So you're already having, your mind is speaking, but it is reflected through nonverbal communication. And patient is aware of that. Think about when you are using public transportation. You enter the bus, you get into the train wagon, and people look at you as soon as you enter. People look at one way, they do this, then they talk, then they whisper. A lot of things going on, right? And you see all these things, and the first thing that you say, oh no, they're not talking, but they're looking at me. Probably they're saying this, probably this, and because the way that they're looking at you, they don't need to talk. They convey many information just the way you act, you present yourself. So if you roll your eyes, you move away, you turn around, you frown, you just, do something that you're not even aware that you're doing it. We do many things. As I'm talking to you, I do a lot of things. I know you can see my face mostly, but I'm moving my hands all the time. I'm here and I'm moving when I'm talking. So that's basically what it is. It's like frittering all the time, because that's what we do when we talk. And when we see something, and whether we like it or we don't like it, it shows with facial expressions, with body movement. See, during an interview, we need to keep eye contact. We try to avoid that. We are a little nervous. We start holding our hands. We start rubbing the hands. We start crossing our legs. We start moving a little bit like you're uncomfortable and sitting and changing positions. We've seen all that. All that we've seen it. Oh, am I going to fail you? You're not going to get the job because of that? No. Because we know that during interviews, people feels nervous. But we've seen every single thing that you're doing. And when you're talking, how you move your lips, your tone of voice, your eyes, whether you're looking down, looking to the side, not looking at the interviewer or the person that you're talking to, in this case, the patient. So it is a lot. Let's see what entails or involves body language. Eye contact, remember? Except for these cultures where, not looking at you when you're talking to them, it is not considered, lack of respect. At the contrary, it's the opposite. You should be looking at the patient. But once again, it's us. You see, when I'm talking to someone as a professional, I have to be looking at my patient. See, I have some of my colleagues done, since we have electronic medical records, the patient is sitting right there, like on the other side of the table. I'm facing my patient and I'm focusing on my screen because I'm typing and writing down every single thing that I'm asking the patient, instead of talking to the patient, looking at the patient. That is very unprofessional. Sometimes you don't even have the desk, right, or your computer kind of in front of your patient, or you facing your patient. It's kind of you're on the side, like this. I'm like this, and then the patient's over there, and I'm typing right here, and I'm talking to you. That is very unprofessional. That is a lack of respect towards the person that you're speaking to. And you're a doctor, see? You're a professional. No, that comes in any specialty. This depends of who you are. We expect this from someone who's not educated. Not even so, the person will be paying more attention to you. But we don't. So eye contact, facial expressions, we always twisting, moving our lips, nose, eyes, closing it, we open it, we twist, we do so many things. I mentioned it already, hand gestures. Not only that we cross our fingers, that we interlace our fingers, that we rub our hands, that we move our hands from one leg to the next, we cross the arms. But we can do things with our finger, remember, to show that we are agree or disagree, right? Or to say hello. You don't need to talk. There's someone all the way on the other end across the street. I'm not gonna be screaming my my lungs out saying hello, how you doing? No, doesn't sound good. But I just wave my hand. See? Someone passing by or entering the office, I just kind of nod, like in a sign of, welcome, hi, hello. So we do a lot of stuff. We don't need to talk. Grooming. See, I'm not being biased, but most of the females, they just go with the hair and touching the fur and put it down, moving it, a lot of stuff. Well, males also do when they have, a little longer hair than usual. Or fixing this, or you have to look good, the tie, it's moving something. You know that it's okay, but you have to do something. Fixing the bell, fixing something, there's something to be fixed. Now, here it says dress. Now, when we talk about dress, is the way that you dress. See, that tells a lot of stuff, whether you are using a long skirt, a mini skirt, tank top, leggings, or whether you're wearing just, formal clothes or professional clothes. So your dress says a lot about you, the colors that you choose. So think about this. Why is it that some of the people like these pants so tight to their body? That tells a lot. So what is it that you go to the beach or you go to the pool and you have to wear these very little, almost non-existent, swimming wear? So all that is telling something. Or at least we interpret it the way that we will interpret it. It might not be your intention. Remember, body language. Body language. So probably it's not your intention to cause us to have those thoughts. But, well, the way you present it, see, it's like judging someone. Because that's what body language does, to judge someone. See, I see someone entering the train and I see all this hair with all these colors. Well, I'm start thinking, oh my God, I couldn't look good like that. That's not the way that I would dress, but this is not me. But we judging people. Remember, impressions about someone. It might not be real, it might not be accurate, it might be false. Maybe I'm biased, maybe I'm a little more than that. Bigot, probably. But that's how it goes. And the more things that we do, the more we are exposed to things. Space, remember, we can talk about that space. Is having space. There are personal space, there are professional space, there are intimate space, there are public space. unfortunately, certain places that are considered public, we are not having the space that we need. It is public, but the circumstances causes that to happen. For instance, we are in a public train or using public transportation inside bus, public bus. It is a public train. But you see, rush hour, depends on the day, depends where you live in. It might be a mad house to enter. They are very crowded. So where is your public space? There's none. It looks like more like intimate space because the people is breathing on top of you if they are not just robbing you for every side. So once again, but this is how it is. So public space is very, very, very important. The space that we give to other people. If you get too close, see, when you are angry, you try to kind of get into the patient's face. That's body language. You make a fist because you are angry. You pull the finger, right? Not to say good morning. So sometimes being aggressive is showed away, or the opposite. You pull yourself away. You don't want to talk to the person. You're like, oh, the patient comes in and says, oh, no, I'm not taking care of that one. Then I turn my back and step away. That's body language. You're telling me, oh, that person don't want to see me. That person don't want to talk to me. Immediately. And we have been in these situations. We know that this happens, but we don't try to control it. We need to control this in the workplace because remember, we're getting paid to take care of this client. This is not the park. This is not the train. This is not public transportation, or we are not on the streets. This is our job, and we need to do something. Tone of voice, remember, depends on how you talk, whether you pitch, how you raise your voice, how loud you become, or you whispering. We know that. See, I already mentioned it. You are entering the train, or leaving the train, or getting to some place, and people stare at you and they start whispering. Do you need that's body language? When they look at you, they just raise their eyebrows, or they frown, and they just turn around, or they stand up just to give you space to open it for you, the door for you. So those are body language. They're not saying anything. So we do reveal a lot of stuff of how we feel about something, whether we like it or dislike it, with our tone of voice. Once again, it's not what you're saying, it's how you are saying it. Your posture, meaning the way that you stand, the way that you sit, whether you're moving, whether you're fidgeting, all those things are a key for body language. That means something. So we do a lot of stuff that we don't even recognize. We're not even aware of this body language. If you want to be aware of body language, tape yourself, record yourself, and then you look yourself back and says, oh my God, I was doing all those faces. Oh, seriously, is that me? But we are kind of unconscious, particularly when you're kind of excited about something. We do so many things that you don't even realize it. I'm telling you, it's happening. So if you see yourself doing all those things, it's exactly what we see in other people. Touch, Well, be careful with touch because there are different types of touch, if you will. See, it's a different touch when you greet a family member, a friend, or your boyfriend, girlfriend, husband, wife. There are different ways of, showing our affection or just doing work. Or I'm just putting my hands on you because I'm drawing blood. But we have to avoid as much as possible putting our hands on the patients. The patient might not feel comfortable with this type of ways of addressing them, if you will. So again, it's very important for us to understand how far we can go, is if all this is needed or not. And that's why when we do a physical exam on a patient or a procedure on a patient, 100% we have to have someone in the room, another medical provider. Usually it is a medical assistant. Even though the medical assistant is not doing anything, is not assisting at anything at all, it's just there to protect the doctor, to protect the patient. A lot of things have happened, remember. So the doctor is not going to be doing anything inappropriate if they have someone else there besides the patient. And the patient is going also to avoid, but most of the time is to prevent that the patients do something against the medical doctor. So that's what you have there. We have to have a chaperone there, regardless whether I need you or not. Oh, just because I'm a male and I'm examining a male patient, no, I have a chaperone. Oh, I'm a female, and no, I don't need anybody because my patient is a female. No, you need one. You have to have one. I have a child. I have to have a chaperone. That's how it works. Oh, why not to have a family member? Sometimes it's not appropriate to have a family member in certain interactions and certain evaluations that we have to do the patient, whether it's minor or whether it's an adult. So again, we need to understand things and not going beyond those things. But remember, sometimes we are very kind of touchy people. So don't try to avoid as much. For those who did with me, or we practice phlebotomy, some of the little practices that we have in EKG, I was on top of you all the time. Remember that I show you a technique where you don't have to be poking the patient to find the intercostal spaces to apply the electrodes. That's for a reason, not to touch the patient, not to be in contact with the patient. It's very, very uncomfortable. In the medical field, this is an examination. This is not your boyfriend, your girlfriend. This is not a personal, physical, affective touch. So for that reason, we have to kind of, measure what we do. The less that you interact physically with the patient, the better. Try to do the less possible. When you're drawing blood, you don't kind of touch the arm everywhere, trying to find veins and holding the hand, arm or something. No. Try to do the least physical encounters with the patient. And I'm telling you, things will be just fine. You just have to change some of your habits. I'm saying in general, it's not that I'm accusing you to do no. That's not my intention. It's just that we are gonna try. We don't know who are we dealing with. There's a lot of crazy people out there. There is a lot of hungry people out there. They're just waiting for you to make a little mistake and then sue the hospital and put you in a very, very tough spot. Believe me. Appearance. So we're gonna go those things that we said because we mentioned this a lot. Remember the way that you dress, whether you're clean, whether your clothes are kind of sad, not unsad. They are not wrinkled, they are not stained. They kind of fits you. Not that they are too tight or too loose, no. Dressing professional. Say a lot about you and a lot about the place that you work at. So again, it says right there, appearance can present conflicting nonverbal information. I already mentioned it to you. You're in the workplace. What are you doing with those scrubs? Very tight, too tight, like you're wearing leggings. That is inappropriate. Yes, I know what you're thinking. I have seen those. Yeah, unfortunately. So that is very inappropriate because people are thinking something else. Oh, this person is insinuating something, and then somebody can make advances. And now you're gonna blame the other person. But again, you are the professional. So if someone make advances at you because the way that you're dressing, well, it is time to see how you're dressing, particularly in your workplace. Too much makeup, too many ornaments hanging in there, big rings on your ears and bracelets and exaggerated things. It's not simple. Once again, less is more. Don't put yourself in situations that have to remove you from the place. Because that creates conflict. That creates conflict with your coworkers. If you are dressing too sexy or too sloppy. So think about it. You're gonna go there and be just average. You don't have to stand out for how you dress, because that's not a beauty context. So stand out for what do you do, your work, how you behave, how you treat your patients, how you do your job. That's what we have to do. So the successful medical system expresses self-esteem, confidence, pleasant facial expressions, and caring attitude. We'll talk about all these. See, when you are mistreating the patients, when you are talking loud to them, rude to them, when you are not paying attention, you're not listening to them, well, you think that you're better than them or something like that? So some people do it because they feel like, wow, my self-esteem is up the roof because I'm the cutest right here in this world. Well, that doesn't work that way because appearance can be a positive or a negative effect on your job. Remember, be neutral. Wear your scrubs. That's what we have people to wear scrubs in the workplace. Try not to tailor to your taste, like once again, taking them to the tailor and, stretching those so they can fit your body. Scrubs are supposed to be a little loose because you're going to be comfortable working around them. So again, think twice. This is the correct word. You have to be conservative. See? Conservative appearance. That's what you have to be. Not to like this one or that one, or to compete with this one or that one with the latest trend. No. It's doing your job, being professional. Because that's what not only your employer is looking for, but your patients are going to be judging you. Remember, when you think that you are the best and I see your attitude, I don't want to be with you. This is not that this is not a dating website. This is not a dating place. I'm not looking for someone to entertain myself. I'm looking for someone who's going to help me out with the problems that I have. Being clean, being dressing conservative does not diminish who you are. So that's basically what you have to think about. Remember, people is having a different perception of who we are. Proxemics, remember, this has to do with the spatial distance, the spacing between you and the patients. But also remember, personal proxemics or spatial proxemics, public, intimate. We're going to have all those. Remember, we have to consider all these culture, environmental factors, because they are there. So there are people from other countries that they dress totally different from, the way that we dress. But in the workplace, it's a different issue. It is a different issue. Remember, people is going to be judging us the way that we dress, the way they conduct ourselves all the time. Well, we're not going to be accepted by everyone, even though if you are conducting yourself correctly, you're dressing conservative, there is got to be something that someone doesn't like it. Well, we don't have to be liked by everyone, but you're going to do your part. Don't worry about whether A, B, C, D person doesn't accept you. You just do what you have to do, what you think it is right for the patient at that moment, for your job. That's it. We don't have to please everyone. That will be impossible. Oh, I don't like you to be dressing that blue jeans. I want you to wear khakis. Oh, wait a minute. And this one want me to wear khakis, but not the blue jeans. Oh, no, wait a minute. That's not what I'm talking about. It's the way that we present ourselves in the workplace. The way that we deal with other people, the way that we talk to other people, the way that we care about other people. You don't have to go the extra mile. You don't. You just do what is needed for that particular patient. That's it. Public space. See here, we have the distance that you have to be separated from the other individual, depending of, in which setting you are. Public space between 12 to 25 feet. Yeah, I'm walking right here, walking across the street. Well, if it is very crowded, yeah. But it's not what I want. It's not because I'm standing in front of you. No, I'm just passing you. I'm just walking. This is like public transportation. The train is very crowded. I'm not going to wait until the train is empty or there are few people there to go. No, I have to go work. I have to meet and schedule. There are certain exceptions. But this person is right breathing on top of me. It's not that I want that. It's that, unfortunately, might not be another way to reach my destination. Social space, 4 to 12 feet distance. When you're socializing, when you're like kind of in a dinner, things like that, that's how we do. Personal space, Now it's a little more closer, 1.5 to 4 feet. Intimate space. Now, this is the one that you want to avoid with someone who has no relation whatsoever with you. So yes, we have to be close to someone when we're doing a procedure, but if you kind of close to that person because this job that you're doing demands that, it won't be for a long time, and you're gonna prevent yourself. You're gonna refrain yourself or doing it too much. Just as much as is needed. Because this is intimate. That's now, boyfriend, girlfriend, or well, we can get intimate also without talking about sex or anything like that with family members. You're gonna give them a hug, kiss on the cheek. Wow, that's for someone who is very close to us. But this is not something that we do just when we socialize in public. Like, I'm talking about people passing by and then, and go then and hug them and kiss them. No, all depends of the situation and based on your culture as well. See, I come from a culture that even though if this is the first time that I met this person, somebody introduced me with them, we give handshake, a hug, kisses. You do that. But with our patients, this is the workplace. I don't know if I told you that when I started working as a medical assistant, I was called into the office by the supervisor. And she told me that there had been a complaint of me hugging and kissing the medical assistants there because I was the only male, and then I'm used to. That's the way that I was raised. That's the culture that I'm coming from. So it says it is not allowed here to do that. Somebody complained already that anytime your co-workers comes in, you hug them and you give kisses, and so they feel very uncomfortable. I said, well, I didn't argue. Number one, because couldn't argue. I didn't speak English anyways. But I understood what they were saying. I believe they brought the translator and they told me and says, oh, no problem. This is the way that my culture I do it. And besides, most of the girls are, Hispanic, and, they never say no. But if that causes a problem, then no, we're going to leave it there. Now I found out who was the person, because that was the person that I was not hugging, because the person never gave me like, the chance, or she was not friendly at all. And she was making faces and all the stuff. So, well, you see, body language. So how am I going to go approach someone, give a hug? And if I know that this person, as soon as see me, she walk away, she stay away from me and all the stuff. So I was like, no bother. I follow instructions and I never did it again. And I spoke to the girls that I was working with. I told them, listen, I was calling to the office and I was asked not to greet you guys, not to hug you, not to give you a kiss on the cheek. So you know what? Don't tell me that, later on that I have changed or I'm different. No, it's just, I don't want to lose my job. And oh, listen, this is something that come on. That's not my girlfriend's. And remember, you don't get involved in your workplace. So the only thing that I want was my job. So that's it. So I want to preserve my job. I want to be safe. So you learn all those things as you go. See, this is a learning process. When something happens to you, learn from those mistakes. Things happen sometimes not because you caused them. Maybe, it was nothing wrong with greeting the girls, the way that I was doing, not to me, but someone else didn't like it. And they said, well, shouldn't do it. Well, I didn't do it. It was my workplace. Remember, this is not outside. This is not my home. So just think about, we have to keep certain distance depending of who are we dealing with. So working with the patients is not a social. This is not personal. This is work related. But sometimes we have to get closer than we expect because it's needed. You need to apply those electrodes to the patient's chest, arms, and legs, right? You need to check blood pressure, pulse. You need to draw blood. So there are situations in which we are applying these proximities, we are applying this touch, but it has to be in a professional way and to avoid as much as possible unnecessary touching, unnecessary, closing, because we have to respect those boundaries. See, what can touch means? So touch means a lot of things. Think about it. If my girlfriend is touching me, what do you think it means? Or I'm touching her. What it means? Or you touching your boyfriend, or that's a different type of touch versus your patients. See, that changed the whole spectrum. Now you can be feeling kind of sympathetic for your patients, right? And then you kind of put your hand on their shoulders, or you even can give a hug to this person or shake the hands and said, you know what? I'm sorry to hear that. Remember, that is sympathy. Remember, empathy, sympathy. Empathy is when you put yourselves on the patient's problems. You understand them. You've been there. You have been facing that because you personally have faced that situation of a family member. So you're familiar with that. So putting on the patient's shoes, that means empathy. Feeling sorry for someone means sympathy. So let's say one of your coworkers comes over and tell you, oh, listen, they just told me that, that they don't need me here anymore. They are dismissing me from the job. Instead of saying they fire me, because they're going to say, fuck. So what are you going to say? Oh, I understand. I'm being there. No, usually kind of doesn't fit the type of comforting kind of expressions that you're doing towards this person. No, the first thing says, oh my God, I'm sorry to hear that. Wow. I wouldn't be in that situation. So that is sympathy, when you feel sorry for someone. Oh, my family member, whatever the case may be, just passed away. Oh, I feel so sorry for your loss. My condolences to you. See, you're not going to say, oh yeah, I feel this way because, have someone. That will be empathy. But this is sympathy. So you can comfort someone. Someone's going through a tough time. So usually you want to be kind of soft on these people. Well, yeah, some people can cry with them, but you should avoid getting your feelings involved. But being nice to someone, that's a way of using touch, not referring to a job that you have to do. But patients can see it as a sexual harassment, and they can actually bring a sexual harassment lawsuit. This have happened where I have worked. The people that I know, they didn't do it intentionally. They went to be too nice. But people uses that against, remember, to not get too friendly. It doesn't matter. Most of the people who works as medical assistants are females. I work in a hospital when the only medical assistant male was me. And I ran through all the situations with the medical assistants being too nice, particularly when they saw a nice, young, handsome guy. Oh, no, 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 no. Albert, that's mine. Let me work with them. See, right there, they telling me they're gonna do something inappropriate. But I'm not gonna get involved. I said, oh well, go ahead, all yours because I don't have to work. Hey, I'm gonna do something else. Let's work for me. But you see the way that they do things in the waiting area, right there behind the desk. Somebody comes in and very good looking. Oh no, I take care of that one. They see someone kind of a little sloppy, old. Oh no, it's your turn. I'm telling you. And some of you know that happens. You heard that. You've seen people doing that. Someone kind of looking a little, not suited for your taste. Let's put it that way. They run away. I work in a hospital. When as soon they saw the homeless bringing me in and they brought the homeless and things like that in a stretcher, some of the nurses, some of the doctors, they disappear from there. This is not mine. Give it to someone else. We should not choose who we want to deal with. It's our job. This is like first come, first serve. If you're there, you're available, go take care of that person without prejudice, without looking who is it, how it's dressing, how it looks, what's the color of the skin, nothing. You just go and do your job. Fair enough. That's why when you start working in a hospital, believe me, you're going to be asked to take sexual harassment training. So they're going to tell you everything that I'm telling you right here. Because there are dirty people out there. Patients, not all the time the patients are right. Remember that I told you. It's because they are our clients. But there are patients who once, who touch you in a sexual way. Because you're female, because you're too close to them. And they think that they have the opportunity. But they can use this against you when you are too friendly. So being professional does not imply being too friendly. Remember that. Particularly people who you notice that they are getting too friendly with you, they're looking for something. They're looking for something, I'm telling you. And if they don't get it from you, they're going to get it through a lawsuit. I'm telling you that much. So be careful. Avoid claims of battery. Okay, there are two things that we're going to discuss this during law and ethics. Assault and battery. So generally, when I ask my students, when I ask people that I interact with, give classes, lectures, train people, when I ask them, okay, what's assault? What is battery? Well, most of the people know what is assault, but they don't know the right answer. They don't have the right answer. So assault is when you threaten me to do something against me. See, if you threaten me, hey, listen, professor, I failed my test. If you don't pass me, you're going to see what I'm going to do. Oh, you threaten me, but you're not touching me. If you don't eat the soup, I'm going to beat you up. That's an assault. We are assaulting our children. And if you beat them up, now it's called battery. You're touching someone without the patient's permission, without the person's permission. That is considered battery, non-consensual touching. That's why every single time that we're going to do something, work on some procedures with the patient, and touch needs to be part of the procedure, we have to let the patient know every single time. Remember when we were doing EKG for those who were doing EKG, for those who we do some type of training for phlebotomy. Tell the patient what you're going to do. I'm going to be doing this, okay? I'm going to be feeling your veins. I'm not going to be touching you because that's not a good expression to say. Oh, mister, I'm going to be touching you, okay? Oh, wait a minute. What's going on? No, I'm going to be doing this particular procedure. In one of the steps of this procedure, I'm going to be, feeling your veins. I'm going to be applying these tourniquets right here on your chest, arms and legs. I'm going to be cleaning or wiping this area. So I'm going to be very close to the person. So that's what you have to do. You have to explain them, because not explaining them the procedure and just touching them without telling them, that means that you didn't get my permission. You have to get consent. You have to get consent. People don't know sometimes what is it that you're going to do. And remember, people is waiting for any little misstep that you do to sue the organization. I've seen so many things going on, I'm telling you, especially in the medical field. Now, are they going to win the case? We're going to discuss that. What entails, what criteria you have to meet to, to win a case. But that's not the point. It's all the hassle that they're going to put you through until they decide or dismiss the case. Can you imagine all the hassle that you're going to put you through? All the trouble that you're going to go through? That's not something that you're going to go through. Definitely not. So be careful with battery. Batteries are questions. Assault, battery, false imprisonment. We're going to talk about that when we get there. But now that we get here, because remember, we're talking about touch. So we have to explain to patients what we're going to do, because we are going to prevent misunderstanding. Particularly because you are females and people wants to take advantage of you. So stay away from touching people unnecessarily. Do the things that you have to do and stay away from all those things. So one of the, times where you can comfort someone, you see, we sometimes identify with the patients for issues that, probably are related to us. Or you just want to be compassionate with that person. But it has to be in a professional way. In a professional way. Not just touching because you want to touch. Not hugging because you just want to be close to the person. Has to be a motive. It has to be a reason. Posture and position. Remember, very important. When we, move, when we are trying to do something, when we reflect something, it's signaling something. Everything that we do, somebody is perceiving something. Might not be true, might not be what really is, but that's what is in their minds. And how can we control that? So when your patients comes in, see, the first thing that I do is that as soon as the patient knocks the door or the patient just steps into the exam room, I look the patient from head to toe. I know if this patient is depressed, I know if it is upset or anger. I know if the patient is snapping, it's just there for something that is not serious. So we know. So you're going to be in front of the desk, right there in the waiting area, on the reception area. And whenever you see patients, pay attention to the patients, how they come inside. When they enter your office, you're not going to be just like a security guard paying attention. No, but when you have the opportunity and you see someone coming in, or you have some type of sounds when the doors opens and people goes in or out, take a look and see who's coming. In the way that they are presenting themselves, they're kind of, leaning forward, they are holding, putting the hands folded on the abdominal area. There are certain ways you're going to be seeing something that is going to signal that something is going on with this patient. Then you prepare. See, a person is very angry. As soon as they enter the door, you see that they are angry. So now you're prepared, you react. They don't take you off guard. So now you know how to react versus the person just snap you right there. Oh, not it's going to beat you up. No, but, just get there and say, hey, I'm here. You got to take care of me. I'm sick. You guys are not doing anything right there. So this is the time that you're going to sit down, and then you're going to prepare. Your mind prepares. And now you can take a deep breath and says, okay, I'm going to handle this patient in a very professional way. So we see all those things when someone is sad, when he's happy. We know people. You see it when they are angry, when they are excited about something. We know that. And that is how you sit, how you walk, how you move. You want someone happy, is going to be straight up and, like smiley and all the stuff. But someone depressed, it's not going to be showing the same signs. Someone angry, totally different. Somebody who's scared. See? So we are going to be paying attention to all these nonverbal communication, because that is how we are going to act or react to the situation. That's how we are going to prioritize who needs more attention, who needs to be taken care, who needs to be put in a private room. So it doesn't, the things that do not escalate. So we have to check all that out. This is very important. The process of communication. Oh, what's that? Oh. So to communicate well, we must have a general understanding of the process of communication. Well, that's what we're doing all this. We usually, when two people interact, they both function as senders and receivers. So here we're going to have the elements of communication. So what is needed for us to have communication? We need at least two people. Remember, we cannot talk to ourselves and respond to ourselves and give orders to ourselves, accomplish it. It doesn't work that way. So again, communication is a process, and it goes in between two or more people. There's got to be a sender, there's got to be a receiver. But when we have communication, you see, I'm a sender right now. I'm sending you all this information. You're receiving that information. So you are listening to the words that I'm saying, to the statements that I'm talking about, and you are a recipient. But then you can talk to me, you can ask me questions. I'm a receiver, and you become a sender. Because this is two-way communication. So when you interact with anyone, not just in the medical field, but because the medical is what we are interested right here, but this applies for any type of communication that we engage in. That's basically what you have to do. You need to listen to the other person and, agree or disagree or ask for more information so you can kind of understand what's going on. That is the communication. So these are the channels communication. Spoken words, written message, body language. When we talk about body language, we're talking about facial expressions, posture, all those things. You're not talking. It's non-verbal communication. Just to make sure that you kind of, keep this in mind, these two, spoken and written messages, anything that is written, anything that is spoken is considered verbal communication. Is that understood? Verbal communication. It is verbal. Anything that is written and spoken. Because I know when we say verbal, we immediately think, oh, this is when I speak. No. If I send you a text message, that is written communication, but it's considered verbal communication because you're reading it, you're interpreting it, and it's exactly what it says right there. Versus body language, it can mean anything. You're not saying anything. It's just the way that I perceive things. If I perceive them, I assume that you're trying to say this, but you're not talking, you're not writing it down. So then it's considered nonverbal. Why? Because you're gonna have questions over there when they're gonna ask you, okay, a medical records is considered verbal or nonverbal? It is verbal communication, it's written communication. A message, an email is considered verbal or nonverbal. It's verbal. If it is written, it's verbal communication. Words that comes from our mouth are spoken words. So keep that in mind. Body language is a different issue. So okay, so I send you a text message. Is that body language? No, not at all. Is that a facial expression? No, it's not at all. Is that has to do something with posture? Not at all. So you see, written and spoken words are considered verbal communication. Body language, posture, positioning, facial expressions are nonverbal. So just keep that in mind because this comes in your exams. So you need to differentiate what is considered verbal, what is considered zero, and what is considered nonverbal. So here is the communication cycle and interferences and whatever else it goes along with. So we're going to discuss this in a little more detail. There is got to be a message when we communicate. It's got to be a message. How can you communicate without a message? And the way they communicate, the way that we transmit this message is totally different too. Through an email, through a text message, through voicemail, through the phone. See the ways that we can communicate in person, to a telegraph or telegram, which we don't use it anymore because now we have electronic stuff, letters, which very It's not used commonly anymore, letters, because now we use everything that is electronic. But that's how we communicate. Different channels that we use for communication. How is this communication, this message, going to be transmitted from point A to point B? And vice versa. Remember, if I send you a message, I'm expecting you to return, give me feedback. So that's basically, so it's a communication in between two, and it goes back and forth. I'm the sender and the listener at the same time. You are the sender, you are the listening at the same time. So what is listening? Well, it says right here that listening is paying attention to sounds of hearing something with thoughtful attention. So it's when I'm paying attention what you're saying. I'm reading every single word and I'm translating that words. So then I can follow up with the person that I'm talking to. Remember, there is always kind of feedback or clarification, meaning, can you please go over that again? Or I wasn't clear about what you're trying to tell me. Can you repeat it? Always being very nice and professional. Don't say, oh, I'm sorry, I don't understand. I don't even know what you're talking about. That is very disrespectful. That is not effective communication at all. You're refusing to talk to me. So remember, this gotta be like kind of, interaction, being interested in what is being said. When you're not interested, when you are not into that conversation, you are distracted, then things are not going to go well. That's not active listening, because listening is not just standing in front of the person and nodding and yeah, whatever. Yeah. It's like someone calls me and I'm not interested in what they have to say. And I feel uncomfortable to hang up the phone. So I make excuses that I'm busy or something like that. But if I see who's calling and I don't want to talk to them, I just don't answer the phone, period. Or I'm not in the mood for answering the phone and talking to the particular person. So I'm not. And if it's someone that I care about, I just answer. I said, listen, I'm not feeling good. I'm not in a good mood. So I don't think that this is a good time for us to be talking, because I don't want to ignore you, because I'm going to need you tomorrow later on. I'm not going to close the doors on me. I'm not going to burn the bridges. So you need to understand how, you see, that is communication, not ignoring you, because I have to ask you again, hey, what happened? Why you didn't pick up the phone? Now I have to give explanations or make excuses. No, be straightforward. And if it is not someone who's important, well, you don't have to give explanation. No, I was out of town. I didn't have signal. I just went to the lake. I went to Maine and I don't have signal at all. Well, you don't know what is Maine anyways. So that's basically what you do. Listening. You have to really listen. This is active listening. When you hear what the other person is saying and you kind of, breaking it down and trying to get a feedback with a solution or asking for clarification. Having a, this type of communication, it's not easy. Effective communication is not easy because we're going to have a bunch of barriers that kind of, block that effective communication. So here are these barriers that affects, listen, or, whatever the case may be. What prevents us from listening? And this is true. You can read it in, you can put yourself in that situation and says, oh yeah, actually, this have happened to me, because it happens to all of us. Our own thoughts distract us. We are concerned about other things. I'm concerned about leaving early, going to pick up my children, going to meet my friends afterwards. So this person is telling me something. I was not even paying attention. See, we get distracted by our own issues, our own situations in our life. That is true. Remember, we talk about that. Or when you think, I already mentioned it, that's not important. See, conversation seems meaningless or unimportant. Oh, someone is crying for me, Argentina, and blah, 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 blah. Well, I'm not paying attention, right? So that distracts me from listening to actually active listening and understanding what's being said. So again, if we get distracted, not paying attention. Remember, when I'm doing something at work, a patient arrives and asks for something, we turn around, we stop doing whatever we're doing, we stop talking to the patient on the phone, we call them and hold, we excuse ourselves on the phone. It's not to say, oh, please hold. No, that doesn't work that way. You excuse yourself and you always pay attention to the person, because that's important. That's how you're going to get the message through. That's how you're going to understand. That's how you don't have to repeat. That's why you don't have to ask for clarification. How many times someone's talking to us, and then it happens to me a lot of times. But in our workplace, I try to avoid all of that at all costs. Emotions. Once again, we discuss all these. You're very angry, right? You're emotionally, physically, you have pain, this is how the patients feel when they come to our office. They don't want to hear you saying anything else that is not going to help them. They don't want to hear that you have to wait. They don't want to hear that your insurance is not active. They don't want to hear that you came late. They don't want to hear any of those. They just want to be helped. Well, when we are through all these things, we are not listening either. Now you're working too much. You're exhausted. Do you really think that you're going to concentrate or pay attention to what someone is saying? You kind of just going to go rest. You don't want to hear anything. When you come from work, depends on the time, depends on the job that you're doing. Depends of, the interactions that you have at your work, depends on how your day went when you were there. You come home, you don't want to talk about, and you don't even want to talk. And usually if somebody talks to us, we kind of snap on them. See, we take it out on people who has nothing to do with whatever is going on with our life. Because we're not listening. We're not even paying attention to what they're saying. We just say, I don't want to talk to you. I'm tired. I don't want to hear that. So in the workplace, it's not that you're going to respond this back to the patients, but you're just not listening. You pretend that you're listening, but you're not. You're not interested in whatever they have to say. Remember what I said before? We sometimes judge people. We're very judgmental people. We are by nature. We're very prejudiced. We start, evaluating this person in every single level. And sometimes we assume that whatever this person is saying is not as important as it sounds. So we make our own conclusions of what's needed, what's not needed. If they don't look good, if they are not young, if they are too loud, if they are, have this mental disability, whatever the case may be, we try to ignore them because it's, oh, I'm wasting my time with this person. Sometimes you ignore them and says, oh, there's anybody that I can talk to. And you start focusing on the family member when it shouldn't be that way. Because the person that comes for the help is this one, not that one. You need the information from the other one, but you should be focusing on your patient. But we don't see that. We don't pay attention to that. That's how it goes in the real world. And we have to change a little bit because we are in a setting in the medical industry when we have to care. We have to be compassionate. Listening to patients. So once again, listening is that you're standing right in front of them and they are running their mouths because you don't know what they're talking about, because you're not care. That's not just listening. Listening is understanding every word they said, processing that information, and then coming out with an answer, a solution, because you're going to interpret that. That's how communication is all about. If there is no effective communication, then there is no active listening. This is what we call active listening. Listening is just, I'm standing right there and I'm running my mouth and blah, 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 and people is just, whatever. Versus taking every single word that I speak, and then you translating that and says, oh, this is the message. Oh, this is what he's talking about. This is what it is important or not important about this. Now I'm going to give the feedback. Now I'm going to respond to that. But if you're not paying attention, meaning not focusing, not being an active listener, then we're going to have a little trouble because I have to repeat and I have to say. And remember, being asked to say it again and repeat it and repeat it, it's not going to go well. We all been through that. So it's not going to go well, especially for the patients. Paraphrasing, I use this term a lot. You heard me. Paraphrasing is trying to use different words. If my patient is not understanding something that I'm talking right now and I say it twice, what makes you think that the third time they're going to understand that they're not understanding the words that I'm using? They are not. Change the words. Use plain language. If you're not understanding this word, I'm going to use another one, a synonym that means the same. Maybe you will be able to understand it, like kind of painting a picture. So you can get the information. Try to get through that message. Not repeating the same thing. You're not understanding that. You're not understanding those words. It doesn't matter how many times you say it. I'm not going to get it. What is going to happen is we're going to get angry because I'm not understanding and you are sick and tired of repeating it. That's basically what paraphrasing is all about. And don't say too much things. Just be brief. Don't just run your mouth talking and talking and talking to the patient. No. Tell something and ask for feedback. Did you understand that, Mr. and Mrs. Smith? Can you repeat back what I'm trying to tell you, please? Then now you know that this person is getting there. And if the patient doesn't have all the information, don't be rude to them and tell them, oh, no, I'm going to repeat it again, okay? One more time. That's not what I said. Oof. Oh, listen up. You're not my daughter. You're not my son. You're not my father. You're not my mother. And now we're going to get into an argument. Because the patient is going to snap. That's not going to take it. I'm not going to take your attitude. I'm gonna ask if it's me, I'm gonna say, you know what? Do me a favor. Can you get someone else that can really help me? Because believe me, this happens all the time. Communication is the way that you communicate, the way that you say things. So change your tone, change the words that you're using. And believe me, the patient is going to get there. If the patient doesn't say everything how it was, don't criticize the patient and say, okay, you know what? Most of the things that I said is exactly, you understood exactly, but remember, besides what you told me, you have to do this, or you have to go and say this. So you have then to complete it, but in a way that I'm feel that I'm helping you.